1925, Alois Mager founded the A. Mager Spezialfabrik Ophthalmologische Instrumente at No. 8 Chausseestrasse in the eastern part of Berlin. The founder is shown on the far left of the group photograph. It was in November of this very year that physicist Wilhelm Conrad Röntgen described electromagnetic rays for the first time, calling them X-rays. These X-rays made it possible to look inside the human body, revolutionizing medical diagnostics in this way. The product range of the A. Mager Spezialfabrik Ophthalmologische Instrumente included a Javo ophthalmometer and a Förster arc perimeter. The first universal trial frame for subjective refraction, which has been preserved in the Oculus archives, originated in the year 1920. In 1922, Alois Mager's son, Wilhelm, entered the firm, running the business from 1924 to 1956. On the 18th of December 1932, the A. Mager Spezialfabrik of Berlin changed its name to Oculus. A vision testing device and AIDA opera glasses, the great sales hit for many years, now rounded out the Oculus portfolio. Konrad Zuse invented the first Z1 computer as early as 1938, laying the foundation for a revolutionary technology which would take several decades to assert itself. In 1947, shortly after the end of World War II, Oculus re-established its business in Wetzlar-Dutenhofen, a region where many optical firms such as Leitz, Hensoldt, now Zeiss, and Minox had already set up operations. In 1947, diplomat engineer Kurt Kirchhübel joined the firm as a new managing partner, running the Oculus business until 1986. In the second half of the 1950s, collaboration with the University Eye Clinic of Tübingen, under the directorship of Professor Heinrich Harms and senior physician Professor Elfriede Aulhorn, was stepped up. A special device for visual field testing, a so-called perimeter, was demanded. Oculus succeeded in meeting the high expectations of the Tübingen Eye Clinic. The first Tübingen hand perimeter was developed, being presented to the public in 1959. By 1982, almost 300 of these highly complex devices had been manufactured and put into use worldwide. The development of this device led to the discovery and technical implementation of static perimetry by Harms and Aulhorn. This examination method still provides the basis for most automatic perimeters today. In 1960, Oculus set up its own injection molding department. Since then, plastic parts have been used for many devices, among them Oculus trial lenses with their new plastic frames. In 1963, Oculus initiated its first conversion measures in Wetzlar-Dutenhofen, with a new office building going up. In 1967, a large-scale conversion project followed. In 1969, Neil Armstrong became the first human being to walk on the moon. Millions of people watched this event of the century on television. For Oculus, close collaboration with Professor Reiner, the former director of the Technical College of Ophthalmic Optics, began. One of the first projects was the original binoptometer according to Professor Reiner, which was introduced in 1975. 1 year later, in 1976, Oculus presented the prototype of the Tübinger automatic perimeter at the IPS meeting in Tübingen. At the Congress of the German Ophthalmology Society in Kiel, the first Tübinger automatic perimeter TAP ready for series production was introduced. In 1980, Oculus also presented a new vision testing device, the binoptometer. This helped establish the area of occupational medicine. In 1981, diplomat engineer Rainer Kirchhübel joined the management of Oculus. He's been running the business ever since. The year 1985 marked the beginning of successful cooperation with Nidec, Japan. Since then, Oculus has been Germany's exclusive distributor of these ophthalmological instruments developed in Japan. Oculus is also the exclusive service provider for these products. The company's service technicians receive annual training in Japan. In 1985, the SDI Biome system for wide-field imaging in vitreoretinal surgery was introduced. It was jointly developed by Professor Reiner of Cologne and Professor Spitz-Naas, the former director of the University Eye Clinic in Bonn. Since then, the system has been modified several times. Today, it is a global standard for wide-field imaging in vitreoretinal surgery. The Berlin Wall came down in 1989. Germany was peacefully reunified. The World Wide Web was introduced the very same year, soon becoming an indispensable part of our daily lives. In 1995, Oculus celebrated its 100-year anniversary with many guests. Various innovations were marketed by Oculus after relatively short development phases. In 1995, the keratograph, a topographer designed for measuring the surface of the cornea, was presented for the first time. Only 1 year later, Oculus presented the twin-field perimeter. The twin-field made it possible to perform static and kinetic perimetry manually and automatically. In 1996, the Heidelberger multicolor anomaloscope for precise differential diagnosis of color vision was introduced. It was followed by the center-field perimeter in 1997, the Conceptor workstation in 1998, and in 1999 another perimeter, the compact Easy Field. The Binometer 3 vision testing device and Easy Loop magnifying glasses came next. In 2002, the Oculus Pentacam, the world's first automatically rotating 3D Scheimpflug camera for clinical diagnosis of the anterior eye segment, attracted great interest on the domestic and international market. Oculus senior manager and diplomat biologist Gerd Köst and the current head of the development department, diplomat engineer Andreas Steinmüller, contributed substantially to its development. Today, the Oculus portfolio encompasses more than 150 devices, among them the Keratograph 5M, the first topographer with a color camera, the UB4 trial frame, the height-adjustable version of which, model Höhenverstellbar, is the only trial frame featuring a vernier scale. Furthermore, a space-saving workstation called Pico, the Binoptometer 4P vision testing device, the Pentacam HR for high-resolution Scheimpflug images, and the Corvus ST, the first seeing tonometer, which records high-speed videos of the cornea. All devices which bear the Oculus name meet highest demands. In-house manufacture guarantees the high quality of these medical products. Quality is monitored during assembly as well. This 3D coordinate measuring device, for example, monitors parts up to 1/1000th of a millimeter. Oculus is very committed to service. A 30-person team attends to new installations, maintenance and repair of all Oculus and Nidec devices swiftly, competently and reliably in Germany and neighboring countries. Oculus devices are sold and used worldwide. Each year, Oculus takes part in about 130 trade fairs at home and abroad. Some 120 specialist dealers from 80 countries around the globe distribute Oculus devices for ophthalmologists, opticians, occupational physicians and surgeons. Oculus has 8 branches worldwide in the USA, the Czech Republic, Slovakia, Poland, Spain and Hong Kong. The youngest subsidiary, Oculus Turkey, was founded in Ankara in 2014. To provide customer care for the target group of vitreoretinal surgeons in North and South America, Oculus founded Oculus Surgical in Florida, USA in the autumn of 2012. At company headquarters in Wetzlar, a new department was created too, the Surgical Division. In 2013, Oculus introduced the world's first single-use system for wide-field imaging, the Biome Ready, to the market. This disposable biome is a revolutionary innovation in vitreoretinal surgery. The in-house development department at company headquarters in Wetzlar ensures that Oculus can act quickly and competently on the market. Internationally renowned physicians conduct research and develop new products and applications in cooperation with Oculus. Countless scientific studies attest to the innovative force and reliability of these products. The company headquarters in Wetzlar-Dutenhofen has been expanded and refurbished several times. In the context of construction work executed from 2013 to 2015, an ultra-modern high-bay warehouse and expanded facilities for research and development, as well as consignment and service, were created. Oculus is a globally successful brand, and it has remained a family business. All 280 employees are part of the large Oculus family. Oculus, a worldwide partner for ophthalmology.